Hi, I'm Benjamin Hill with Mission Physical Therapy. Today's subject is a little bit about the healing process, which is really vital for you to know in order to heal more quickly. I believe the healing process is a God-given power in our bodies for our bodies to heal itself. And physical therapy and other interventions that you might receive out there, other services you may receive, if they work well, it's because they will complement that healing process that's already built into our bodies. There are a couple different things. Muscles, for example, get blood flow by our heart pumping blood to them through the circulatory system. Your joints get their nutrition with the secretion of synovial fluid, which is a nutrient-rich lubricant that's secreted in the joint by little membranes that are like glands, kind of like your salivary glands, that are in the joints. And so for your joints to get the proper nutrition, they need movement, unrestricted movement. And so physical therapy will often do things to restore normal muscle tone and normal mobility to joints so that you get that nutrition. Now, in the case of an injury or a condition where you hurt, you have some things going on that can be potentially negative. People often speak negatively of the inflammatory process that happens as well as scar tissue. Now, without those two things, you would not heal. They're not bad. And so if instead of trying to just stop inflammation, you try to facilitate it and help your body to go through that part of the healing process more effectively, you'll probably get better faster. And likewise with scarring. So it's a lot like spackling a hole in the wall. I don't know if you've ever had to do that before or seen somebody do it, but if you get a hole in your wall and you clean that up a little bit, and you put some spackle in there, you're the inflammation. You're that mechanism that's bringing the spackle to the wall. The spackle itself is a lot like the scar tissue. It's filling in something that's not there anymore. And our body uses scar tissue to mend bone together, to mend tendon and ligament or muscle tissue together. And the inflammation is what gets it there. There are certain cells that eat up damaged tissue, and they don't have legs. They can't just get up and walk there. And so they're brought there with that inflammatory process. So that's the first phase of healing. The second phase is the scarring phase. And the third phase is the remodeling phase of that scar tissue. And that's similar to spackling as well. After that spackling has had a chance to cure or set and it's dry, you can then sand it down, apply some texture, and then eventually paint it. And the goal in the end is that you can't tell where that hole was after you've spackled it. You want it to look like the rest of the wall. And similarly, when we heal and we get through that inflammatory process and the scarring, and the scars had a chance to remodel, you want it to look like the original tissue. And what forces you apply to your body and when you apply them make all the difference in whether or not you create more inflammation or you do things to reduce it, or whether you create more scar tissue or you're able to do some things to help it to break down and remodel and become like that regular tissue. And this is the thing that physical therapists are probably most expert in is understanding that healing process and knowing how to restore your normal movement and function again. I'm Benjamin Hill with Mission Physical Therapy.